Hi guys, Prabi from ProPhysio Plus today, and we're going to be talking about thumb pain and what you can do to alleviate your stubborn pain. So please like the video, subscribe to our channel and share with your friends. Alright, let's jump on in. So guys, what causes pain in the thumb? Thumb pain can be split into three simple categories due to number 1, repetitive stress injuries, number 2, traumatic injuries, and number 3, inflammatory disorders. Repetitive thumb injuries result from progressive overuse of the thumb. An example of this would be the condition mentioned below, trigger thumb, that is caused due to repetitive gripping motions over time. Other injuries include osteoarthritis, tendinopathies, carpal tunnel syndrome, joint irritation, strain, or ligament injuries. Traumatic injuries can occur when the thumb is placed in a position that causes undue acute stress to the joint, which can lead to fractures, volar plate injuries, or catcher's thumb injuries. And lastly, inflammatory conditions such as rheumatoid arthritis and gout are usually due to underlying ongoing medical conditions. All these injuries can present differently and usually have swelling, reduced range of movement, and a loss of strength in either the thumb or wrist, and of course, varying levels of pain.
Okay guys, so a common issue with thumb injuries is to do with tendons. So if we have inflammation of these tendons over here, what can occur is really painful movements, especially with gripping. So if we look over here, we can see the tendons of the EPB and the APL, and over here the EPL, which is the extensor pollicis longus. Now what these form is what we call the anatomical snuff box. Now a really easy test to see whether you have a positive sign for something we call de Quervain syndrome is a test called the Finkelstein's test. So all you need to do for this one is have your hand spread out like so. You're just going to grab your thumb and you're slowly going to tilt your hand downwards like this, okay? So what we're doing is putting tension on these tendons over here, and a positive sign will be a reproduction of your pain.
All right, so we're going to ask a couple of quick fire questions, and lovely Mike is going to answer all of them and give you guys plenty of helpful tips. So Mike, what causes pain in the thumb?
So thumb pain can be split into 3 categories. So the first one being repetitive stress injuries, the second being traumatic injuries, and the last inflammatory disorders. With repetitive thumb injuries, these result from progressive overuse of the thumb, and an example of this would be the condition mentioned below, which is trigger thumb, that is caused due to repetitive gripping motions over time, and other injuries can include osteoarthritis, a tendinopathy, carpal tunnel syndrome, joint irritation or strain, or ligament injuries. A traumatic injury can occur when the thumb is placed in a position that causes undue stress to the joint, which can lead to fractures. This can be things like volar plate injuries or catcher's thumb injuries. Lastly, inflammatory conditions such as rheumatoid arthritis and gout are usually due to underlying medical conditions. All these injuries can show in a different way. They usually have swelling, reduced range of motion, and a loss of strength in either the thumb or wrist, and of course, varying levels of pain.
So how do you relieve thumb pain?
So there are many ways of relieving thumb pain, but the first thing to do would be getting it assessed by a healthcare professional. This will allow the condition to be diagnosed, the best treatment to be prescribed for that particular condition, and prevent the condition from getting worse if you are doing the wrong thing for that particular injury. However, here are some methods that have shown to help with thumb pain. The first being rest and avoiding movements that cause your pain. Next is icing the affected area, especially if swelling is present. Lastly is compression, such as using an elastic bandage. And lastly, you can just elevate the area, keeping the hand raised above the heart to help with swelling and pain.
So what does thumb arthritis look like?
Yeah, that's a good question. So the thumb, especially the base of the thumb, is one of the most prevalent sites in the body to be affected by arthritis. Here are some of the most common symptoms that you might feel with thumb arthritis. The first being swelling and tenderness, especially at the base of your thumb. Next is an aching sensation, especially after excessive use of your thumb. Next is loss of strength, especially when gripping or pinching items. The next is reduced range of motion, and lastly, you'd have an enlarged appearance at the base of the thumb. This could be due to bony spurs, especially with severe arthritis.
So Mike, what are the symptoms of tendinitis in the thumb?
Yeah, so this is most commonly known as de Quervain syndrome, or tenosynovitis. This pertains to inflammation of the tendon sheath on the side of the wrist at the base of the thumb, just around here. So if you spread out your hand, you can locate these tendons, being the EPB and the APL tendon on the bottom area, and as well as the EPL tendon right on top over here. And these border what we call the anatomical snuff box. So as we mentioned earlier, these injuries are due to repetition of the thumb or wrist motion. Therefore, over time, as the tendon is overloaded, inflammation occurs which is followed by a thickening of the tendon sheath, further entrapping these tendons. So this can lead to radial-sided wrist pain that radiates up to the forearm with thumb or wrist movements, and especially with grasping. Other symptoms include pain, which is described as a dull ache or burning sensation. They can be aggravated by repetitive lifting or grasping. You can also have reduced thumb abduction range of motion or weakness or tingling in your hand.
So Mark, how do I get rid of tendinitis in the thumb?
It's a good question, Prab. So during the acute phase, especially, rehabilitation goals include managing initial symptoms of inflammation and reducing pain. So this can include splinting, avoiding aggravating movements, icing, or using non-steroidal anti-inflammatories. After this initial phase, it is important to look for long-term strategies. If you're treating this through conservative management, then this would most likely involve isometric or eccentric loading or strengthening of the tendon prescribed by your physiotherapist. The aim of this stage is to ensure positive adaptations within your tendon in order for you to complete the task or activities that once bothered you pain-free.
So Mark, thank you for answering all the questions. They were really helpful and plenty of tips there for everyone to utilize and use in the future. So there you guys have it. We've laid out how you can improve your thumb pain. So please let us know how you went with it. Like the video, subscribe to our channel and share it with your friends, and we'll talk to you again soon. Remember, making healthy simple.